I work as the coordinator for the Saskatoon Poverty Reduction Partnership. I also work as the community evaluator for the Housing Initiative Partnership, which looks at the PIT count, which is the point-in-time homelessness count. And then I do another jointly coordinated role with Bonnie Heilman, which I think you probably know Bonnie. And we co-coordinate the the Safe Community Action Alliance, and that team just recently released a crystal meth report around alleviating the crystal crisis in town, and so that's the work that I'm tied to in that project. And then I do a bunch of other sort of community, vulnerable population, community development work in a bunch of different agencies. And so when we heard that the Indian Métis Friendship Center, which is the center that holds centralized intake for homelessness, was closing because they didn't know how to cope with the pressures of COVID, we realized very quickly that service agencies who are providing essential services to people who are the most marginalized and the most oppressed in this community are going to have a lot of closed doors. And so how do we make use of the folks who can and will work, and how do we join forces together to make sure that those folks who need services can get access to services, because they don't have capacity to make phone calls or to hop in their car and drive to the other side of the city, those kind of pieces, right? So we didn't know what to expect, so we put out a couple of feelers to a couple of critical agencies, Aid Saskatoon, White Buffalo Youth Lodge, the Food Bank and Learning Center, Friendship Inn, and said, hey, like, what are you thinking? And as soon as they realized some of us were thinking about it on a more strategic, collaborative level, it just sort of snowballed and got super complicated super fast. Because like normally we're not service delivery folks, right? We just talk about service delivery from a policy perspective. And as soon as the service delivery folks were realizing that people were willing to help and come together, people just started coming together. And we work in a way that's really quite collaborative, and is driven by people's energy, and it's meant to be like consultative and really like rooted in a collective impact model. And we realized quickly that urgency and crisis interventions cannot be run like that. We can't have 3-week conversations about what we're going to do in COVID, because 3 weeks is actually like 900 years in COVID time. Yeah. And so we reached out to the emergency measures folks at the city and said, so like, what is the plan from an emergency operations center perspective? And as soon as they realized that we were talking about vulnerable folks, they offered to sort of mentor us in what they call as the incident command structure. And so it's very hierarchical and very rigid and not the way we do community business. And we're like, no, that's not how we work. Like, don't tell, nobody wants to be the boss of anybody, that kind of stuff, right? And so the more we learned about it, the more we realized, like, oh, you know what, we might actually have to. And what it did was clear up all the chaos. It created lines of communication. It created very set like roles and responsibilities, and people knew where to go to get what and how we could work together and where the holes were. And so we were putting it together for the first couple of days. So this would be like in and around March 17th. And about 4 or 5 days into it, we realized like we really had to like either adopt this system or get out of it. And so we decided we would just jump into it with both feet and embrace it. And so that meant that somebody had to step up and be the incident command. And so that's the boss of it all. And so there was much chatter about who would be that person. And originally I was like, okay, fine. I reluctantly was like, this is not how I work, and this is not what I want to do. And Bonnie and I work closely together. And so I'm like, this is going to strain the collaborative relationships that we work within, because I don't want to be the boss. And so, but it became really clear that someone had to be the ultimate decision maker. And so I put the hat on and we ran with it. And so once the decisions were made around how we were going to work, started to filter into community, people latched on to the jobs that they wanted to do. And like probably within 2 weeks, which seems like not a lot of time because it's really not, we created a 35 staffed government structure that looks at mechanisms to support people under 2 big vulnerabilities. So housing and homelessness precarity, and food insecurity. And so those were our two critical pieces, that if people were, and not necessarily just COVID related, this is the other thing that's sort of important in this work, is that all of the things that we're fighting for inside this system existed pre-COVID. And these are folks that their circumstances are further exacerbated by the lack of service and the COVID restrictions. And so, yes, there's new homelessness because of COVID, but most of the folks that we're talking to and supporting have like generations of homelessness and poverty in their lives. So it is the most marginalized, oppressed, and vulnerable folks that we set out to say we need to make sure that they don't get sick. For a couple of different reasons. They are generally already immunocompromised and highly susceptible to the virus. And we probably have, so the point in time homelessness count says we have at any given time about 500 folks who are homeless, but we know that number probably is closer to about 3,000 because many of the people who would be precariously housed or couch surfing or not living on the streets but are homeless in non-COVID times have friends and family that they couch surf with. And so what happened with COVID was many folks were just like, yeah, like uncle can't stay with us anymore because it's too risky for other family members. And so lots of those folks got pushed out of their circumstances and onto the street. So then from a public health crisis perspective, we were worried that if the virus took hold in the shelter population or in the homeless population, that the hospital system would be inundated. And so our number one sort of battle in the beginning was keep COVID out of the shelter system and figure out how to get people sheltered and isolated outside of that system and what they're about. Yeah. And so the team basically, the ICS structure basically gave us a mechanism to create teams. And so there's general staff teams. So there's an operations team, there's a logistics team, there's a planning team, and there's a finance team. We also knew right off the get-go that the provincial government's financial responses to this work would be minimal at best. I would say it's non-existent based on what's happened in the last 70-ish days. And so we reached out to the funders and said, and we have existing relationships with many of these funders, right? Because they fund community work all the time. And so we reached out to CARM and said, you know, how can the Community Foundation help us with this? And can you work in a much different way? Because we don't want to create a granting process. It has to be nimble, but it has to be accountable and it has to be equitable. And so some of the folks that wouldn't normally qualify for funding need to be able to qualify for funding. And so they agreed, and so they set up the portal. And so there's been almost $370,000 that's flown through that portal.
Oh, wow. Hey, Colleen, I wanted to ask you a question here, because I think sometimes when we hear the name of a charity, or in this instance, you know, the name of the fund, it's tough for people to sort of break down exactly what that means and where that money is going. I guess one thing that I really appreciated right from the get-go when I learned about the fund is just how nimble and swift this money can be passed along to those who need it most. Can you speak to, you know, any stories that would give people sort of an understanding as to here's how it worked and here's where the money went and how quickly it went somewhere?
Sure. So we knew right off the get-go that there was a pressure to keep people home. And but you can't stay home when you need stuff. And so normally people who are food insecure would go to the Food Bank and Learning Center and pick up hampers and do the sort of normal process stuff. But we knew that folks wouldn't necessarily be able to do that. And the Food Bank and Learning Center and the Friendship Inn is closed. They don't want lineups of people and all that kind of stuff, right? So we thought, well, how can we get food to people? And so STC, Tribal Council through White Buffalo Youth Lodge thought, well, we know we have a group of folks and families that we support. You know, how can we deliver food to these people? And so they basically put an ask in through the portal to have an allocation for food. And then we also worked collaboratively around takeout containers, etc. And so over the course of the last probably 2.5 months, we've allocated enough money to buy 65,000 takeout containers to push those meals into people's homes. And so that would be upwards of about 1,300 meals a day going into people's homes through a delivery mechanism that STC and White Buff created. And we also gave, so the interesting thing about Tribal Council is that it has a unique set of jurisdictions as far as funding. And so it's often that we're not in the same pools of funding. But we assured the Tribal Council that when they came as a partner and let the interagency response partner with the hub at White Buffalo Youth Lodge, that they would be eligible for this funding pool. And so they asked for food money as well. And so there was an initial $20,000 investment from the allocation to buy food to make sure that they could actually make the meals to get them delivered. And so they're just winding that down. Like we're in a bit of a transition right now, but over the course of, since the start of this, we've delivered upwards of about 1,300 meals a day to people.
Wow, that's impressive.
Yeah, and some of that funding would have been matched. I mean, that's the other thing, because our money is so nimble, they can then use that money to match other money because it becomes their sort of operating money. And so community agencies are really good at multiplying their dollars with other dollars.
Yeah.
Yeah.
You talked to about being in a transition period, and I sort of find with being in that transition period, there's almost a bit of a mentality that we're through it, we're done. And that's not the case. And I just want you to give me your thoughts on that too.
Yeah, so we're building a system that we hope is going to be maintenance, but we know that COVID will probably surge. And I think it's important as people start to come out and we start to see more and more folks out and about to realize that the most marginalized people are often the most impacted by our behaviors. And so when I have a fair amount of affluence and privilege, and so I can manage to do all the things that I need to do to keep myself safe. But folks who do not have that privilege or affluence don't necessarily have the supplies or skills or abilities to keep themselves safe. And so when I go out and about and potentially spread the virus, because I could be asymptomatic, and I'm at places where people may be vulnerable, they may not even have the capacity to protect themselves. And the worry for us is that as people go out and about and do the things that they need to do that are maybe not necessities, there's a likelihood of increased risk to people who are the most vulnerable. And in summer, those folks are out and about a lot more than in the winter. And so the likelihood of us crossing paths is a lot higher than it would be, say, in January. Yeah, so, and again, if or when the virus takes hold in this population, it will be catastrophic for folks.
I've been sort of not surprised, really impressed that nothing has happened thus far. And would you say that that's directly correlated to the work that you're doing in trying to keep people housed and isolated? And when you said that, or sheltered and isolated outside of the shelter system, is that within the hubs that were created, or are there other systems in place?
Yeah, so one of the monumental things that happened right in the beginning was the health authority recognizing that there needed to be an accessible testing site in the core neighborhood. And so the local health authority team basically moved mountains. We're the only city that has a core neighborhood, no referral needed testing site. And so that testing site, it's at Princess Alexandra. It takes in walk-ins, and so anyone in the core neighborhood can walk in. I mean, anybody can walk in. We're trying to deter folks from driving from Evergreen to get tested, but I mean, they can theoretically. But so then what ends up happening is people can show up there symptomatic or asymptomatic, and they get access to some supports, health supports and community supports. But then they get tested, and if they need to be isolated because they can't go back to where they were living, so if we're overcrowded, or maybe they're homeless, or maybe they're from the shelter system, what we did was partner with the Ministry of Social Services and Red Cross, who is providing sheltering through hotels. And so those folks then were isolated in the hotel. And we were very adamant inside the interagency response around the importance of meeting people where they're at and providing extensive harm reduction-based services. And so in the beginning, the conversations were, well, you know, like certain agencies would take care of these people in the hotel, and there wouldn't be a lot of hands-on face-to-face supports and services. And so the expectation would be that people from the core would then go to the hotel, which is not in the core, and just have a telephone. And if they needed meals or mental health supports, they could make this 1-800 number call and press 2 for mental health supports, that kind of thing. And all of us who work in the sort of vulnerable sector are like, yeah, I don't think that's going to work. So, like, we should probably have a conversation around what really needs to happen. And then Aid Saskatoon and the Lighthouse really stepped up and said, you know, we'll collaborate together to make sure that these supports and services happen. And so the Lighthouse runs a managed alcohol program. And so we had extensive conversations to make sure that people who needed access to alcohol could get access to alcohol. People need to smoke, and so we needed to buy. And so that's one of the other things that originally we bought with some of the money was cigarettes, because people in the beginning, when isolation started to happen in hotels, the breakdowns and why people weren't being compliant, that's not great language, but that's the government's language, why they weren't being compliant for isolation was because they needed to smoke. And so they didn't have cigarettes. So they would leave the hotel, go out onto the street, look for butts and ride the bus and wouldn't isolate. And we're like, so let's just give them cigarettes. Like, this is not a hard thing. And so we spent $1,000 very quickly. And because the interagency response doesn't have a lot of red tape as far as what we can and can't spend our money on, it was really easy for us to pick those supplies up and drop them off at the hotel. And then that also challenged the hotel and the Red Cross around smoking policies, right? So you're not theoretically allowed to smoke in your room, but you have to isolate. So let's have a conversation what that looks like. You know, and what is the food source, and what are, like, all of the pieces around what people actually need to feel secure to self-isolate. And then where they were coming from once they were established in that space, like, where do they come from? What do they need moving forward? And we lobbied really hard and still are lobbying around the vacant housing authority units. And so there are a lot of vacant units in this province that the housing authority, the provincial government manages. And we have a homelessness population, and we can't understand why we can't house homeless folks in the vacant social housing that the government manages for us. And so
what would be the primary concern there, if I may just interrupt for a second, in terms of reallocating those housing units? Is their primary concern, like, at a really baseline level, that people will destroy these homes, that they, and what would be your counter to that? How do you solve that concern, or is there a way to solve that concern?
Yeah, so I mean, we've solved that concern in this process, and so yes, that's, I mean, ultimately that's what their worry is. But if you talk to the folks who are working in that system inside this agency response, they gave us, so the housing authority gave us 10 units. Once we got access to those 10 units, they've been pretty much full ever since. And some of the people that are housed in those units haven't been housed in over 30 years. One of them in particular hasn't been successfully housed ever. Like, they're well known to community practitioners, but there's been a successful process in place now for almost 30 days. This is the first time that she's been, like, secure enough and supported enough. And so the issue is not about getting access. Like, yes, we need access to the houses, and then we need long-term support around wraparound services, and we need to make sure that those services are delivered by people who the clients respond to. So Indigenous services for Indigenous people by Indigenous people. And then also we need to make sure that it's the right kinds of services that are judgment-free and harm reduction based, and start where the client is actually willing to start, as opposed to imposed by sort of a colonial construct around what the expectation is to be housed.
Right. And so did I see correctly that we as a province are failing or falling behind incredibly when other provinces have responded in tens of thousands of housing units, and we have literally been given 10 as an entire province?
No, I think
just
10 in Saskatoon. I think there might be like 6 or 7 other ones, but I haven't heard of any successful housing. I think to be fair, I think maybe there's 30 total that they've allocated to the provincial landscape, but I haven't heard from partners across the province whether they've had any successful housing placements with those units.
When you have success stories like that and you see the opportunity to support people in holistic ways, fully wrapped around, would you say that the agencies that we have in place right now have the capacity to increase that kind of support? Should we have the allocation of housing? We do have the capacity of care.
Yeah, I would think so. Like, I think it would be lovely if there was a bit more resourcing of that care. But yes, and so the interesting thing about the hotel strategy is all of the services provided inside the interagency response to clients that were being supported by the Ministry of Social Services, all the support services were provided by community with community dollars, right? And so we recognized that they wouldn't be providing the harm reduction services that needed to be provided. And so Aid Saskatoon and the Lighthouse, who do that kind of work all the time, seconded staff to provide those services.
Okay. Can you just give us a couple examples of harm reduction services?
Sure. So needle exchange, managed alcohol program, even providing cigarettes and smoking opportunities. Basically,
literally meeting people where they're at for what they need. Without
with no judgment. Yes, exactly. Yep. And understanding that the circumstances that led people to need those things are the circumstances, and that's okay. And so let's start today where you are and talk about getting the things that you need, and then from there talk about what we could do to improve the things if you want to.
Can I get you just to maybe give a little statement as if you're speaking to, you know, our city of Saskatoon, our people, in regards to the t-shirts, and you know, we've made some progress. We're stalling a little bit here. We want to kind of build momentum again. Can you say something to the city of Saskatoon about the importance of grabbing a shirt?
Sure. Yeah, so I really think that when the opportunity comes to come together again as Saskatoon residents, we've already started talking about what it would look like if we came together with us all wearing shirts, because the shirt actually represents the commitment of community members to recognize how important it is to keep vulnerable folks safe and secure and healthy in COVID times, but also moving forward. And so the idea is that when I heard about it, and I think Jen Peterson from the Community Foundation first connected me to this, I was really excited because I think it's a tangible way that people can show that they care, and that the money then is going into the direct delivery of services to folks who are the most in need. So I would encourage everybody to get a shirt. We've been trying to push it through our network as well. And I would challenge everyone in Saskatoon that when we're allowed to gather again to talk about what we've learned from COVID and the response that when we came together to respond for the vulnerable population, we can come together all wearing that shirt on, like, in front of City Hall or in the park or whatever it looks like. I wouldn't want people to miss out on the ability to participate in that coming together. So go out and get a shirt and support us and support the most vulnerable folks. The people that are doing the tireless work inside the interagency response need the financial supports to continue this, because it's not coming from anywhere else, and community has been left to figure this piece out. And we've come together to do that.
Thank you. Thank you for that. Yeah, very well said. You can say it better than I do. Thank you.
Well, I think that's kind of the intention that we've had here, is we really just need some better language now, because it's continuing to grow, and we need to deepen, you know, our own understanding. So thank you so much for making time to
thank you guys. You're the ones that are generating funds for us. So we've been talking about it because, like, even the portal itself, we didn't really none of us are fundraisers, right? So we're like, how do we drive people to the portal? We're like, I don't know. We just hope that the Community Foundation's logo is enough. But we're actually talking about that now that we have about $165,000 left in the portal. And we're a little bit hesitant to drain it to zero because we don't know what's coming. But we also know that there's so many people out there who do not have the capacity to procure things or to support their staff in a good way. And so things like infrared thermometers and all the assessment tools that are going to be needed in phase 3 and 4 are very expensive and very hard to get. And so one of the things that the interagency response has been able to do is build relationships with distributors so that we can get in on orders as if and because we are frontline health providers, even though we're not health authority workers, but we are providing essential health services. So now we've convinced suppliers to put us on their primary contact list, and so we're getting quicker access to materials. And so if agencies were left to do that on their own, they just simply wouldn't get access to those things. Yeah.
Wow, some great information here today. Thank you.
Yeah, no kidding. Is there anything else that's kind of pressing on your mind that you want us to make sure that we're aware of or can share?
I think probably my biggest red flag right now is around access to public washrooms. And so it's not really a funding thing, but I think people don't realize the complexity of closing all the services. And so essentially folks who are in need of public access, public washroom access, have had nowhere to access washrooms for over 70 days. And so you can do the math, what that means. We have stories from Frontline around moms with small children trying to find access to washrooms and feminine hygiene products and having to resort to dumpsters and park alleys and those kind of things. And I think it's at this point we're almost talking as if it is a human rights issue. People need access to clean water, and they need access to potable water and toilets. And so we're at a point now where I think we can manage the reopening of things, and so we would really like to stress to the folks who have public washrooms and agencies like the City of Saskatoon and others. They're all in the conversation. It's not that these conversations aren't happening, but they're maybe happening a little slower than we would want them to. And so access to public washrooms is a big piece right now. And I think it's something that people don't think about, right? Because I have a washroom, so I don't have to think about it. But it's an unimaginable choice to have to make.
Yeah.
Especially with children, being anybody, I can't imagine as a mother what that would look like. Thank you for bringing that up. I had not thought of that.
Me neither.
Well, if you need anything from us, we're here. We're connected now.
Yeah, that's great.
Definitely, yeah.
And just for your awareness, from my tourism organization, we're about to launch a corporate challenge next week, challenging businesses within the City of Saskatoon to buy T-shirts for their teams, and then challenging other organizations to do the same. So this kind of information is going to be so helpful for me to deepen their understanding as to why we're doing this and the contribution that we're making as a city. And I think your idea is great of everybody gathering in these T-shirts.
I love that. Yeah, I think that's fabulous. Yeah.
Awesome.
And just so you know too, we're going to extend the line a little bit or expand the line a little bit there. We're working with an Indigenous company here as printers, and man, their enthusiasm has just been phenomenal in all of this. And you know, they really have stepped up with a number of different ideas, and so we are going to expand the color line. We'll have a few different colors that are optional for people as well. So because certainly on social media you see a lot, wow, if they weren't white T-shirts, I'd certainly, you know, buy a shirt. So all right, well,
all right, here's the black one.
Yes, put your money where your mouth is, because they're available. So we're going to be launching that here probably coming up on Monday too. So
that's awesome. Great. Yeah, and if there's anything else that you need from us as far as like more information or me to talk to somebody or whatever, that's other things that I do. So
wonderful. Okay. Thank you so much,
kindly.
Colleen. Have a great weekend and good luck with your child that needs attention today. We feel you. We totally understand.
Yeah, she's like, can we please leave the house? I'm like, fine.
No, totally get it. Okay, have a great weekend.
If you can pass along a huge thank you. It's been amazing to hear some of these stories and just how nimble you guys have been in putting all of this together in such short order. And I mean, we were at a time there where things were changing with information about COVID. It seemed like by the hour, by the minute, you know. Yeah. And the fact that you guys have pulled this off, like, hats off to you. And if you can pass along a thank you to your staff and everybody who has, that it's been phenomenal. Congratulations.
Yeah, it's been an unprecedented collaborative process, and like folks inside the system tend to get a bit emotional about it. It's been a really interesting mechanism because a lot of the red tape around policy and practice have basically just disappeared. And so moving forward, we're very cognizant of the things that people have done to make things happen. And so, yeah, we're not going back. Not happening.
That's great.
Yeah.
Amazing. What an incredible outcome.
Yeah.
Okay. Enjoy
Right
your
on.
weekend. Thanks again
Yeah,
for
you
the
too.
time.
Right on. Thanks so much.
Take care.
Bye.
See you,
Okay,
Colleen.
bye.